A very good evening to you all who have joined in today for today's podcast. I'm Dr. Kiranmayi, chairperson for the Fogsi No to Violence Against Women Committee, and I would be your host for today's Gyan Pravah, the Flow of Knowledge podcast. And this is the innovative and out of the box initiative of our President Fogsi, Dr. Sunita Tandulwadkar, madam. So today's topic is on violence. And in 1999, as far back as 25 years back, it was UN Secretary General, Mr. Kofi Annan, who had said that violence against women is the most shameful and most pervasive human rights violation. And as long as it exists, we cannot claim that we are making progress in equality, development, or peace. And it cuts across the borders of culture, wealth, and geography. And women make up 50% of the population, and 30 out of that 50%, the global estimates say that are facing some kind of violence. Which brings me to the title of the podcast, Violence as a Public Health Emergency. I have taken this from the quote of none other than our distinguished guest here, Dr. Eleanor Vadinobi, Madam. But before I introduce our guest, it's first my privilege to introduce our President Fogsi, Dr. Sunita Tandulwadkar, Madam. For me, if I have to describe Madam, it would be very difficult, but she's a multidimensional, multifaceted, multitasker of multitaskers. Her core areas of interest are infertility, endoscopy, stem cell research, and ovarian rejuvenation. She has headed the national organizations for all the three, and now she heads the Federation of Obstetrics and Gynecology Societies of India. It is a 46,000 strong organization, and of course, she has numerous awards, achievements, and she's the creator of the first stem cell baby of India. There are many more things to her, but beyond all these individual great or organizational achievements, for us, she's the backbone, brain, and heart and soul of the team Fogsi 2526, of which we 30 chairpersons are all part of. And each of us, I can vouch for all of them when I say that she inspires us to do more innovatively in a more inspiring way and to, better ourselves each day. So this is what Dr. Sunita.
Kiranmayi, today is you and Eleanor.
Yes.
So let me welcome her on the Foxy platform. This is Gyan Pravah podcast series of my all chairperson. Believe me, I'm one of the luckiest Foxy president who got best of the committee chairperson they can dream of. They are my leaders. They are leaders of Foxy tomorrow. And everyone is working to their fullest. They all are so motivated, so creative, so passionate, so hardworking. What is important is they need a platform. Up till now, I felt whenever I used to observe, they really work very hard. And sometimes we as a president get the name. And that makes you little uneasy to take the credit when they are working. And I was always used to think, what can I do for them that they will make themselves, we are special. We belong to Foxy. Foxy belongs to us. We are on a very important chair. And then I thought this podcast series, I need to thank Dr. Ashwini Kale, Pooja Loda, who sat with me to come out with this brilliant idea where we get to hear 45 minutes, beautiful interview and the dialogues between the two experts. Eleanor, thank you so much for saying yes to Kiranmayi and coming on this platform because violence against women is her forte and you are, I think, the brand ambassador of it. Whenever this violence, I don't know when it will end. Today in city of Pune at 4 a.m. in the bus, an educated 30-year lady who was going to her hometown was taken in the dark bus and raped. Today, it is such an unpleasant thing. I don't know, where do we stop this violence? Violence, it may be abusive, it may be physical, it may be to the extreme. But I think various these podcasts, various dialogues of globally of all the women, definitely one day this community will feel ashamed of themselves and the things will improve and we have to voice on. So Kiran Mai, thank you so much for such a wonderful topic with such a wonderful personality. Thank you.
Thank you, madam. Now it is my honor and privilege to introduce our distinguished guest, Dr. Eleanor Vadinobi. Madam is the Medical Women International Association president. She's the first Nigerian to occupy this chair, and she is in the Hall of Fame of the government of Nigeria because of her 40 years of dedicated work. She started her career as an anesthesiologist, but switched over to public health and gender and human rights expert. And she's on board on many international and national organizations. She's a gender-based violence expert, human rights expert, UN, WHO, African Union, the Economic Community of West Africa, then the Tony Blair Institute, so many other things. And most importantly, she's the co-founder of Every Woman Treaty. It's a treaty which is meant to global coalition to end violence against women globally. I think this is one wonderful initiative that I thought. She's also co-chair of the Immunization Agenda 2030 of the Partnership Council. And I think to start with, Madam had started Widow Development Association. That such was her compassion and empathy and dedication. I think I can go on and on. Madam is a mother and a grandmother and a wonderful personality. The moment I sent a mail, she immediately accepted. And I think I shared with Sunita, Madam, that Dr. Eleanor has accepted. I'm so happy. And then we connected, and Madam has tried to put me at ease all these days. And it's a great honor, ma'am, to have you both and to be in one frame with both of you. Thank you so much, madam.
To add to your biodata, you are one of the great faculty on Gyan Pravah Fogsi 2025.
There you go. Thank you so much for those gracious, generous words of introduction. I am really honored, truly honored to be on Gyan Pravah. Thank you so much, Kiran Mai. Thank you, Dr. Sunita, for providing the platform. You are such an inspiration. Thank you for your leadership. You know, one of the American presidents, I have to remember the name of the president, but that president said, if you are a leader and you look behind and nobody is following, you are simply taking a walk. But here you are, Dr. Sunita, you are leading and you have over 46,000 members following you. Thank you for your leadership.
Thank you, Eleanor. And now I'll leave and join from other link, and you and Kiran will be in the platform together and have a wonderful dialogue. Thank you.
Thank you, ma'am, for being with us
Thank you, Dr. Sunita.
Every single day at 8 p.m. Thank you, Sunita.
Thank you. My pleasure.
Yeah. Thank you.
Ma'am, where would we start? I think the right place to start is the organization that you are heading, Medical Women International Association. Can you tell us what this organization is about? It was so inspiring to read about this organization.
Yes, indeed. The Medical Women's International Association, an association of female physicians from around the world. We are in the 8 regions of the world. As women doctors, inwardly, we look at how we can encourage and promote one another, especially our younger members. You know, we were formed 105 years ago, soon after the Spanish flu. And what was the situation at that time? The situation was that there were very few women doctors. Some women had to dress and pretend that they were men in order to be able to carry out their profession. The equipment was not suited to men and women, medical equipment. In fact, even the masks and the protective apparel were designed for men in such a way that even when women needed to go to the bathroom, the design of the protective equipment for the Spanish flu, just like we had the COVID recently, was not designed for women. So women decided that they would band together, they would support one another in their career development. So we stand for women's global health promotion. Outwardly, we are also serving the communities in which we reside and work. In our everyday lives, as medical personnel, we bring health, healing, and wholeness to our patients, but also in the broader community. We look at communicable diseases, non-communicable diseases. We look at mental health, for example. So we ensure that we bring health education to the communities that we serve. As doctors, we sometimes provide pro bono services. We are able to go into these communities with medical education in such a way that those in the communities can better understand how they can institute first aid, how they can get better access to health care. And we also ensure that our members make themselves readily available to the communities that we serve. There are also other issues that are affected by health, because health is wealth. And when you lack health, then you lack wealth. When you lack health, you are not at peace. So you can see that it's important for us to look at health holistically. And the triennial theme that we have says one humanity, health solutions through partnerships. That recognizes that you and I and humans, that we are one humanity, that we have our strengths, our weaknesses, our vulnerabilities, but we are first human, and we should respect one another and respect the rights of one another, and that we can bring health solutions through partnerships. Our motto is, I'll just round up and say that our motto is Matris Animo Curant, which you can see on the background, that talks of healing with the love and spirit of a mother.
That's wonderful, madam. So you said the organization looks inward and then outward, towards self and then towards the community. I think that's what Fogsi also does and doing towards women's health. And you have been a medical doctor to begin with, but then you shifted to public health development and the gender expert. And how did this change or the shift come about? And a little bit about your childhood and a little bit about Nigeria, the background, the way you have grown up and how you have reached this position.
Thank you, Kiran Mai. Just to say that I heard from my parents that from the time I was 5 years old and we came across a road traffic accident, I said to my parents that I would like to be a doctor because I could see that, my father, who was a veterinary doctor, and my mom, a nurse, that their being there on time at the scene helped to save those who were in the road traffic accident. And as a 5-year-old, that spoke a lot to me. And I said, I would like to be a doctor. My parents took that seriously. And when I grew up, I decided to study medicine. And mind you, the culture that I come from in Nigeria, in Igbo land, for those in the rural areas, there was a culture called son preference, which means the son was preferred and girls were generally not sent to school. That was not the situation with myself. I was fortunate and blessed to have parents who believed in educating the girl child. But when I discovered that I was the first female doctor from my village, I was motivated to be an inspiration, a mentor, and a role model to other young girls, because it wasn't right that I was the lone star. I believe that when you have many stars, that we reflect our light on one another and we shine together. Having said that, I started out in anesthesia as a resident, and when I discovered that there was a culture in the part of Nigeria that I am from, in the southeast of Nigeria, the Igbo-speaking part, I discovered that there were harmful traditional practices against widows. And when I discovered that this was a practice in the rural areas, I wanted to find out more. Unfortunately, at that time, which was in 1994, widowhood rights, RITES, practices were seen as taboo. People didn't want to talk about it. And I was dissuaded from asking questions. But I had a particular burden for widows who were going through harmful practices. So I carried out a survey, which was an independent survey, to be able to have some data. And through the Medical Women's International, I presented my findings. And of course, my colleagues said, surely we cannot just stop with the data. Something more has to be done. So upon returning from the conference in The Hague, the Medical Women's Conference, I was able to find some very brave compatriots, women like myself who were brave and wanted to speak up about these harmful practices. And we did some more research. Suffice it to say, I found myself spending more time going into communities, creating awareness, talking to traditional and religious leaders in order for the harmful practices to stop. What were these harmful practices? Women had their hair shaved forcefully. They were stopped from socializing, going to the market to shop for their families. In some very extreme cases, the body of their husband would be washed, and the woman would be asked to drink some of that water. And if she did not fall ill, it was proof that she did not kill her husband. So widows were being accused of witchcraft. And that's how I found myself doing more work in communities, looking at the health and mental effects of widows. And guess what, Kiran Mai? That was around the time one of the Beijing conference in 1995. So the awareness had increased, but also there was a public health issue. HIV and AIDS was at that time very prevalent. Now there was a practice where the widow was passed on to the next surviving male in the family. And as you can imagine, if perchance the husband died of AIDS and the surviving wife was a carrier of HIV, it then meant that whoever inherited her, according to the culture, sexually, would then have the disease. So the prevalence increased on account of this practice. And I was approached by UNIFEM at that time, which today is UN Women, to do some work in the rural areas to try and stop this harmful practice. And we were able, with our research and with our awareness creation, to take the message in order for those practices to be reduced. Two things happened. Nigeria became a democracy again in 1999 after military rule, and we were able to get a law passed, especially in the state, Enugu State, where it was very prevalent. And I personally felt that I needed to learn more about human rights. And I went and did a human rights master's. And that's how my advocacy at national and now international level, it took 6 years to get a state law passed. It took 14 years to get a national law passed, protecting widows. And today I'm working at international level with the Every Woman Treaty, including some Amazons from India who are also working on harmful widowhood practices in India and in other parts of the world.
Thank you, madam, for sharing this, a very inspiring journey. I think it was your calling, your empathy, which has shown you the way and the place where you have reached and the journey that you have made. This law that you're talking about, is it the violence against person prohibition, which I had read about, the 14 years long struggle that you were talking about? I mean, that was so inspiring to struggle for 14 years, not to leave the issue till it is passed in Parliament. I think that's some solid action.
Thank you, Kiran Mai.
Yes, ma'am. Ma'am, this is, it's only of late, maybe 10, 15 years that we are familiar with the usage of the word violence against women, VAW. And also we are using few other terms like intimate partner violence, gender-based violence, domestic violence. What is exactly the violence against women and which word is preferable, and can we use one for the other or the same? So what encompasses exactly the violence against?
That's a very good question, Kiran Mai. You see, what we need to be fully aware of is that today, as we speak, on the average, more than 133 women or girls are killed every day, sometimes by somebody known to them or in their family. That is according to UN Women.
Yes. The 2023 report on the global femicides.
Exactly, the 2023 report. It's also such that globally, more than 1 in 3 women are raped, beaten, or assaulted, according to WHO in their report. This was pre-COVID. Now, why am I saying this? If we now restrict ourselves to definitions, we will stand by and see more women killed, maimed, scarred. And when I talk about scars, I'm talking of visible and invisible scars. Because remember that there are some women and girls who have suffered violence that has been either emotional, verbal violence, and they have been left mentally scarred. So it's good to have frameworks, but if we get bogged down with definitions, what will happen is that the energy that we should use in working towards bringing an end to this, as you rightly said, what I termed, a public health emergency. It is a pandemic. Yes. It is a pandemic. So it's a human rights violation. It's a public health emergency. It's an economic crisis. And when we look at gender, for example, in some instances, the word gender actually drowns out the pervasive marginalization, exclusion, and violence that is primarily targeted at women and girls simply because they are women and girls. We also have to remember that because in so many cultures, there's the invisibilization of women and girls, there are still communities today where a girl is not even called by her name. She is addressed as, hey, you over there. Or they might give her the name of the daughter of, and they will call the father's name. So if we get bogged down with acronyms, get bogged down with glossaries, get bogged down with definition, we may further bring about that invisibilization, marginalization, violence. So we need to preserve the legitimacy of the space for women and girls and concentrate more on ending the violence that women and girls suffer. We could look for alternative narratives, such as gender-based violence against women and girls in their diversity. That way, we ensure that within the nomenclature and framework of gender-based violence, that the violence that women and girls suffer in their diversity is not hidden.
So whatever we are, describing the words, it should not hide the violence that women are facing. So primarily it is the women and the girls, and our terminology and the way we focus has to focus on primarily the women in diversity and in all their intersection, in all their vulnerabilities.
In all
Thank you.
their vulnerabilities. Mm-hmm.
Yes. And these statistics, the femicide report, and the pandemic time, when we had heard time and again that it is a shadow pandemic. And your statement, which is, I thought was very clear and hard-hitting towards the fact that it is a public health emergency. This showcases how critical the issue is. Madam, you are in the global arena and you have been in the 40 years of journey in this. So can you share with us what has been the progress internationally? For example, the UN or the CEDAW, which we hear of, or the international conventions have done so far to, combat and prevent this violence against women.
Thank you so much. If I may go back to, calling it a pandemic, we commiserate with, all of us who in the recent COVID-19 pandemic lost loved ones. You can imagine how painful in circumstances where, on account of the pandemic, we could not even be with our loved ones in their dying moments. Truly, truly traumatic in every way possible. So every death leaves mourning, loss, loneliness in one form or the other. And just to say that with the COVID-19 pandemic, we were able to very quickly, thanks to our researchers, we were very quickly able to come up with vaccines that stopped the pandemic in its tracks. Yes, we have other strains of the virus. Yes, COVID has not completely left us, but it was declared a pandemic. Now, the extent to which women and girls are dying, where UN Women tells us that every 10 minutes, partners and family members have killed a woman intentionally in the year 2023 by the UN Women study. That is of pandemic proportions, which is why we called it the pandemic within the pandemic, when, because of being locked down, women and girls who would have been able to escape from those who perpetrated violence, they were locked down. And even shelters were not available. We called it the violence that women suffered, the pandemic within the pandemic. UN Women called it the shadow pandemic. The UN Secretary General Antonio Guterres called for a ceasefire within our homes, showing that it was like a war zone within homes on account of violence against women and girls during the COVID-19 pandemic. So I want us to realize the enormity of when we say it is of pandemic proportions. But going to your question now, it is not all bleak. The reason is that when you look at the fact that it took 4 years at subnational level for us to pass a law to bring an end to harmful widowhood practices in Enugu State, and then it took several of us human rights defenders to work 14 years to get the Violence Against Persons Prohibition Act passed in Nigeria. We know that in order to bring an end to violence, there are certain things that work. The first thing is that there should be legal reform, that there should be enactment of laws. But laws in and of themselves that's not the be all and end all. We need to be able to train law enforcement agencies. We should have survivor support systems. That's what we call the whole hand approach. So the legal reform, the training and accountability of law enforcement, doctors, lawyers, judges. We need survivor support services like shelters, helplines. Violence prevention education is crucial. And then for all of these, there must be dedicated funding. Now, we have had since 1979 something known by many as the International Bill of Rights, called the Convention on the Elimination of All Forms of Discrimination Against Women, CEDAW for short. It's a human rights treaty that was adopted in 1979, and it has been instrumental in advancing women's rights. However, because it was brought about to deal with discrimination and not violence, the CEDAW committee came up with General Recommendation 35, General Recommendation 12, and General Recommendation 19. These recommendations provide provisions for things such as trafficking, forced marriage, violence against women and girls. But unfortunately, a general recommendation is a recommendation. It's a soft law. So what we are advocating for now under the Every Woman Treaty is a hard law, an optional protocol to CEDAW that uses the text of General Recommendation 35 so that nation states would have a legally binding roadmap to prevent violence against women and girls. And that is the work that is ongoing, where we are doing a lot of advocacy at the moment.
So this is something that we all have to look forward and work towards. The international binding law wherein, they can be accountable, whether it is a country or a community which has been involved in discrimination or violence. Otherwise, as you have said, it's a soft law which has no teeth, maybe. Yes. Thank you, Madam, for elaborating and very clearly explaining the CEDAW, the general recommendation, and the optional protocol. So, which brings us to the work that we are doing as an organization. Foxy, like MWIA, has been focusing on the social and community issues which the women face beyond the gynecological and obstetric issues. So in 2022, I think Foxy might be maybe one of the very first organizations to have a separate committee, that is No to Violence Against Women Committee, and which I have the privilege of being the chairperson. And as you have told, the education part of it, we have had a Dhira initiative, which is a school certification program with Foxy and UNICEF, and around 10 lakh children were trained on this, beautiful module created by the experts. And we were all part of this Dhira initiative. Dr. Shanta Kumari, the past president and the present treasurer, Tigo, was very passionate, is very passionate about this topic. So are all our president Foxys. So this is the work of organizations, this is the work of UN, and this is the work of human rights, advocates and all. Then should the government be doing more? Because, when COVID, there was a pandemic, how the governments of all, just took it to their national priority or the international priority. And we had, ringtones which told us what precautions we have to take. And even we have cyber crime now, and we have ringtones which tell us what precautions to take. But violence against women being such a critical issue, is it receiving the required focus by the governments? Because, considering the mammoth proportions and the impact and effect it has on, half the population.
Kiran, there's a proverb that says, if evil lasts for a long time, it will become a tradition. In other words, it will become a habit.
A practice.
A practice, absolutely. So we need our governments to do more. Yes, we have some governments that have taken the initiative. For example, we have regional treaties. In Africa, we have the Maputo Protocol. And indeed, out of Africa, the good news is in early February, the African Union met and they have adopted an improved regional convention to end violence against women and girls. In Europe, you also have a treaty called the Istanbul Treaty. In Latin America, you have a treaty against violence against women and girls called the Bellum de Para. So governments have taken some initiative. Regions have taken some initiative. But unfortunately, what has happened is because there is currently no global optional protocol or treaty, it means that not every woman and girl in the world is covered So we know, for example, that India is not covered. We know, for example, that China is not covered. And so that's why we are speaking for a global treaty to end all forms of violence against women and girls. As we speak today, we have at least 117 nations where child marriage, which is a violence against women and girls. In fact, child marriage is another form of rape.
Absolutely.
And child marriage exists in these 117 countries. So unless and until nation states come together and we have this global treaty or optional protocol binding norm, so we need governments to do more. But we cannot leave it all to government. Even though the pinnacle of commitment needs to come from the heads of states, every single one of us, either as human rights defenders, non-governmental organizations, those of us in academia, the incredible work, thank you for sharing this committee that Fogsi has. And, I commend the leadership of Fogsi, as well as yourself chairing the committee and what you are doing in going to schools. It's hugely important that it is a whole of government and a whole of society approach. And that is why with the Medical Women's International Association, we talk about one humanity. And then we talk about health solutions through partnerships. Look at the beautiful partnership today between Fogsi and the Medical Women's International Association, as we have this Gyan Pravah podcast.
Thank you, madam, for explaining it so well. Indian government has been, we should say, very proactive. We have a very liberal MTP Act. We have a Child Marriage Act. We have a domestic violence, and we have one-stop crisis centers, which are called Sakhi centers. These are in thousands in each district. And as part of the committee, we are trying to work, as you have told, the 5 fingers of the hand, involving the lawyers, involving the police, involving the one-stop crisis centers and all. But much needs to be done. But thanks to you, the future is not bleak, as you have shared. So that puts towards, another important aspect. When we are talking about women, we cannot leave men behind. So men as partners, men as allies. See, I think I will not be out of place if I quote this by Fuad Alakbarao. Not all men practice violence against women, but all women live with the threat of male violence every single day, all over the earth. And that brings the thing into such a, very clear this thing. But again, having said that, men are our brothers, men are our partners, men are the part of the society. We are exactly the half of the humanity. So how to take men along, or is this onus on women to take men along? So what should the men as the partners do?
Right. Thank you. Thank you so much. Let me first of all go back. Thank you for sharing, the amazing initiatives that are going on in India. The world has seen the great level of commitment, and as you've said, having the one-stop centers, shelters, etc. That's so commendable. We are also looking to heads of governments to take this message to the United Nations, and as they are doing in their countries, to call for other nations to come alongside them so that we move from the national to regional and international. So I wanted to make sure that that commendation, recognition, and encouragement to our heads of states is made clear. We would be doing ourselves a disservice if the aircraft of preventing violence against women and girls is being forced to take off with one engine. We need the men as allies. We need to ensure, which was why one of the 5 prongs that I mentioned using the whole hand approach is prevention education. We cannot leave it to men alone. We cannot leave it to women alone. It has to be that partnership. Research has shown that violence prevention influences boys' and men's attitudes and actions. It also encourages women and girls to demand their rights, thereby lowering incidents of violence. So, violence prevention education in both the formal, such as what Fogsi is doing, what MWIA is doing, but the informal, the very first school is the home. Absolutely. How do we ensure responsible parenting, bringing up our male children to respect the female children and vice versa? So it has to be a joint approach, and we need to be allies to one another. Another danger of speaking just of male allies is now putting that burden on men. And remember, we already have negative masculinities, negative peer pressure. But when we talk of allyship on both sides of the aisle, men and women allies, meaning that the allyship rests on both men and women, so that that respect of rights is recognized by men and women because we are one humanity.
That's a wonderful note on how to be, one humanity. I think we are coming to the end of this wonderful conversation, madam. Very enriching, very enlightening, very delightful. I would like you to leave us, us meaning the Foxians, the women, the students, many of them will watch this YouTube video and they have joined live too. Maybe young women leaders, your parting message and the challenges that you have faced as a woman personally, which are life's lessons or which are, a parting note, a guidance from your side.
Yes, my personal mantra, which I got from my daily devotional as a woman of faith, says encouragement is like sunlight to a closed flower. And therefore, I want to see that we encourage one another. The reason being that every single one of us, we have, as I said before, something to bring to the table. We also have our vulnerabilities. So we need to recognize that in one another. Let us make sure that we encourage one another so that the closed flower embraces our encouragement, which is like sunlight. For each of us, let us make a commitment to relegate violence against women and girls to the history books. I like to give the example of the treaty for tobacco. Because we have a tobacco treaty, clear in mind, because we have a tobacco treaty, when you go on an aircraft, no matter where you are in the world, the crew must announce to you that smoking is not allowed on the aircraft. So we want the aircraft that is Mother Earth, that is carrying humanity, men and women, boys and girls, that there shall constantly be that announcement, that commitment that violence against women and girls is not allowed. Every opportunity is an advocacy opportunity. We are using the opportunity today with the Gyan Pravah podcast. Thanks to your leadership as the committee chair. Thanks to the leadership of Dr. Sunita as the president of Fogsi. Like Martin Luther King said, let us look at the fierce urgency of now. Yesterday was the time for us to bring an end to violence against women and girls. If we lock our elbows locked, with that partnership, we form a formidable frontier against all forms of violence against women and girls.
I have been hearing a podcast which you have given an interview on the 16 days of activism on gender-based violence. These were the most inspiring words. I have noted it down. Elbows locked. Together, we will do this. And the words on encouragement, sisterhood, that we have our vulnerabilities. So focusing on the positives, focusing on the better, qualities that each of us have. So let's not shun away from giving encouragement. Let us not shun away from, lifting each other up. It's been really, really a big moment, a kind of, the time since I have read about you and the moment Dr. Sunita Madam had said about this podcast, I mailed you without much hope that you would respond. Not only have you responded, but today this podcast has made it a reality that we could converse. And all thanks to Dr. Sunita Tandulwadkar, all thanks to my organization, my parent organization, Fogsi, and all thanks to the Medical Women International Association. Thanks a lot, Madam Eleanor, and namaste. Thank you.
Namaste, Kiran Mai. Thank you.
Thank you, ma'am. So this ends the podcast today on a very, very critical issue of violence against women. So tomorrow again at 8 o'clock, there would be another podcast. The guest speaker would be Dr. Ashish Shetty and another colleague of mine, Dr. Kanchan Sharma, a chairperson of the non-communicable diseases, would be taking the conversation forward. So please tune in every day, Gyan Pravah, 8 p.m. Thanks a lot, ma'am. Thank you.
Thank you. Keep up the good work. All the very best.
Thank you so much, ma'am.